We're still in the very early stages of sort of planning for undertaking group clinics. So we haven't actually done any yet. So still in the learning phase, if you like. As a result of that, we've done a number of other, well, I say a few other training events with other organisations. What I found with them was that they focused quite strongly and at quite great length on why undertaking group clinics is a good idea. And that's something that I felt was, I didn't really need to know at the time. I wouldn't be looking into it if I didn't think it was a good idea. So what I found particularly interesting and helpful about the training session here was that it focused very strongly on the how rather than the why. So good tips about how to manage difficult conversations, how to make sure that all the patients in the group are involved, even down to what's an ideal, in ideal conditions, an ideal number of patients to be able to undertake a group clinic. So I found all that extremely useful. Well, we've got, we started looking into group clinics primarily, rather than from a clinical aspect. It was at least in part to provide development opportunities for a couple of our administrative staff. And in fact, one of our receptionist administrators is joining the same training event, but later in August. She wasn't free on the event that I had last week. And I think from that perspective, it will be extremely useful. I mean, I mentioned earlier that we're still in the very early stages of planning to undertake group clinics, and we still need to involve some of our nurses. We've got a lead GP who's very interested in the concept, and will be undertaking the training himself fairly soon. But I thought that for the level of an administrator who is quite businesslike but hasn't done anything within the NHS other than reception work, I thought it was a very useful introduction, and the focus on the how it might work, and the use of employing all of the people on the call to talk through potential pitfalls and how to overcome them. I thought would be an excellent way of giving confidence to somebody at that level who maybe hasn't done it before. I mean, I'm old enough and have done enough work outside the NHS to be confident that I could probably run a clinic if I had to, without the NHS or clinical knowledge, of course. But it might be a bit more daunting for somebody younger and less experienced. And I thought that the event gave really good grounding for pretty much any level that would be involved.